Well, hello, everyone. This is Jeannie White, station manager at Passionate World Talk Radio. And today we're going on with continuing with the series with Sheila Wilson and Stop Hair Care Violence. And I'm turning this over to Sheila. There you go, Sheila.
Hi, everybody, and welcome. I hope you will be enjoying our show. Just a quick recap. My name is Sheila Wilson, and I'm a registered nurse. And I am the president of Stop Healthcare Violence, which is a nonprofit organization that was developed back in, the nonprofit was 2019. But Stop Healthcare Violence started in 2008, and I became the president in 2009. With our program, what we wanted to do is to educate and inform the public on the alarming epidemic of violence committed against healthcare personnel. And that is what my guest is going to talk about. But first I want to say thank you to Passionate World Talk Radio and to Jeannie White for allowing us to use this time on their radio. My guest today is Virginia, we call her Ginger, Weymouth Ferreira. And I hope I got that last name correct. Hello, Ginger.
Hi, Sheila. Yes, you got it correct.
Thank you.
Nice to be on the show. Thank you for asking me.
Thank you. Now, I know because we work together, you were assaulted at work. Can you tell me and the public about the assault? There's so much confusion. They think the nurses are causing the assaults on some of them, and then they think some of the patients are just mental health patients, or they're intoxicated, or they're high on drugs, and they're basically saying that they don't know anything. They can't tell right from wrong. Can you tell us about what happened to you?
This particular assault actually led me to leave emergency room nursing. I had been an ER nurse for 23 years. On this particular day, we had several ambulance cases come in. One was from a shelter, a local shelter in the area. And this woman presented with pinpoint pupils, really not responsive, very slow, would answer some questions. But I had that sixth sense that so many nurses develop after years of being around people, that there was something going on that I wasn't seeing. And I felt uncomfortable around her. I felt unsafe. So I kept my distance, presented in a wheelchair, and I had her get up, and she did stand up and get onto the stretcher. And then she just kind of played possum and wouldn't interact with me. I needed to get her undressed for the doctor's exam and to do vital signs. She just wasn't cooperative. I could tell she didn't really want anyone to bother her, which, you have to give people some control. But I did need to check her blood pressure. I didn't know if she had taken something or what her level of, what her condition was. I had, before I even approached her, called security to come down, just as a show of force, because I felt that she was going to get out of control pretty quickly, because she could really move. She was playing possum, but she could move and she could answer questions. So she wasn't somnolent or out of it in any way, shape, or form. Security did show up. I was standing next to her, but with my back to an opening so I could step away. The security people, for some reason that day, the F team was on. And
the what team?
The F team. It wasn't the A team. I mean, usually they'd come in and the routine was, show of force, cooperate with the nurse, and someone would stay in the room with you. And sometimes they'd turn their back if it was a woman, away from the stretcher just to give them privacy. But you were never left alone in the room. Well, for some reason, these security guards closed the curtain on me and left me in the room with her with the curtain closed and said, "Be good for the nice nurse."
Well, that's always helpful.
As soon as that curtain closed, she reached up and grabbed my stethoscope, which was around my neck, and started strangling me with her left hand. With her right hand, she went to hit me in the face. I was standing on her left-hand side. I yelled, "No," as loud as I could and pushed myself back off the side rail to get away from her hand, and she narrowly missed my face. And at that point, the security people came in, but I was pretty winded. I couldn't talk at first. She really had choked me pretty well and pretty fast. I lost it. I've never, ever lost it. I've never been able not to just, keep my mind focused at the task at hand and help the patient. I was not mad at her. I was mad at the security people. I was left defenseless. I had asked for help. I was let down. I was so surprised that this happened. I mean, it certainly wasn't the way I wanted my day to go.
Right.
I never, ever, ever cried at work, except at maybe losing, a patient, a death. And I just couldn't carry on. I had to go down to the break room, and I think I was hyperventilating at that point and calmed down. And I called my husband, which I never do. I would never bother him at work, just to ground myself. And I kept saying, I'm leaving. I can't believe they did this to me. I'm done. My life is not worth it. I can't, count on people to have my back, which teamwork in an emergency room area is so very, very important.
It's more important than a lot of people even realize. Without a trained security guard, you're done for.
And they've always been there for us. We've had many incidents of nurses being assaulted, and they didn't follow the procedure, so the whole thing fell apart. It's so important for them to have that training, and to work as a team with the nurse. But that didn't happen that day. My charge nurse, she kind of didn't even check in on me. Like, everything bad that could have happened that day happened. The medical director at the time happened to be the ER, Dr. Ron. He came up to me and said, "Are you okay?" And I said, "No, I'm not." And I walked away. Another nurse did step up to the task, and she took over the care of that patient. That patient was later admitted to the psych department of that hospital. And come to find out, she had been just released from jail and was in a shelter and probably was not dealing with being out of jail was just looking for a way to get back in, I don't know.
Well, we certainly met enough people that wanted overnight visits.
Right.
Because they were either homeless. I mean, they were okay, but for their lifestyle, that they were homeless, and some of them had mental health issues.
Correct.
But they weren't violent.
Well, she had a history of violence. She had a record of assault, and that's what had put her in jail to begin with.
But you didn't know that.
I didn't know that at the time. I just felt that, I needed to be careful of her. The way she presented herself led me to believe I need to be careful. But that in an instant ended my ER career.
So you left ER nursing altogether?
I did. I left ER nursing altogether. I do have to say, though, that the supervisor that was on that day was very good to me. And she came down and spoke to me for a long time and had somebody from the psych department counselor come and talk with me also, which I really appreciated. And think fondly of her to this day for doing that. But I really knew that if I couldn't be safe at work, I did not want to be there anymore.
Right. Were you ever assaulted before that?
I had been assaulted plenty of times. My first heroin overdose in the 1980s was this little skinny guy who was a Marine, and we gave him the Narcan. Back then we gave it IV. He woke up and punched me in the nose.
Right, that was a tough drug to give. You had to be a good almost 5 feet away from them after you pushed it.
When they woke up. And I learned after that you needed to restrain them before you woke them up, because they would wake up very violent. And most of these guys had been, Vietnam vets and had combat training, and you need to be careful. They didn't know what they were doing. But, and hit by assaultive people, alcoholics, and I learned to, if I was going to be in a situation, to have people with me, to always have a way to get out of the room. Those tricks that you learn how to read body language of somebody who's escalating, when to call for help before it got to be really dangerous to yourself or other people. And that,
in many hospitals. I'm sorry. Go ahead, Ginger.
That's okay, Sheila. I lost my train of thought there for a minute.
Oh, I'm sorry. In many hospitals, they have, as the patient comes in, on their registration form, there is a check mark on whether or not they had been violent before. So what some hospitals are doing is that when that chart pulls up, they know already that the person has had some sort of a violent outbreak. So the nurse is well aware of that, and she can, just like what you said, have somebody with her.
Yeah.
That way it makes it at least a little bit easier to handle the patient. But you left nursing.
No, I left ER nursing.
Oh, you left ER
actually,
nursing.
It's funny, that day I had just finished up my bachelor's in nursing. I've gone back to college and finished that up. So I had been kind of looking around to see what was my next, what I could do next. and I had actually applied to the VNA. And the day of this incident, they called at work. And I never get phone calls at work unless they're an emergency. And the secretary kind of said, "Ginger, you have a call?" I said, "Oh, I better take this." And I accepted that other job that very day. I just
Good for
said,
you.
This was meant to be, and this is my way out. My husband kept saying, "Oh, you really can't just quit without another job." So I went home that night saying, "Guess what? I have another job." And I did VNA nursing for a while, and then so I ended up going back into hospital work, working in a PACU situation in a holding room of an OR, which I enjoyed very much. It was very controlled. It was back to the team, which is I miss that very much. When you're a VNA nurse, you're very much on your own, and I loved that. But I did miss the team approach to working. So I did other things that I always wanted to do, and there's a lot of other things out there that we can do as nurses. We just don't realize it until you take the plunge.
Right. Now, there's been a few solutions to the violence, not a whole lot, but now that you have experienced this and you've gone into other levels of nursing, is there any solutions that you can think of off the top of your head that you can share with us?
I think what works really well is that the security department needs to be a really important one of whatever facility you're in. If it's a community health center or doctors, anything, they need that security. I think cameras are important, but more than that, the ongoing training of how to run a de-escalation situation, and something that everybody follows. Just like when there's a code being run, there's one person who's running the code. Someone should be running that situation. Someone who's not in the middle of trying to restrain somebody, someone who's backed off a little bit. I have seen many situations where everybody's jumped in, but nobody's the head, code runner of that situation.
Right, no direction.
And somebody invariably gets hurt when that happens. You've got the shortest, weakest, nurse trying to hold this guy's leg down. I mean, that doesn't make any sense at all. Put your tallest person, everyone's trying to talk to the patient. Don't talk to the patient. You need to de-escalate. Let them be quiet. You put that show of force, and even if it is, four-pointing them and restraining them, just do it quickly, without so much drama and trauma to everybody, and then let that person be quiet.
Right, and of course you can medicate them as well.
And medication.
Now our time is running out, and I don't know if you know that they have little hooks now on your waist that you can put your stethoscope. Excuse me.
Oh, that's a great idea.
And
any place I worked after that, I wore it in my pocket.
Excuse me for that cough. The stethoscope is actually a weapon for us. That they can use against us. And unfortunately, many of us have been strangled. Yeah. The other thing that you had commented on is the security guards. And that's really, really important. They really, I think, need to be in touch with reports.
Yeah.
And to really be included, not just to stand there and wait for something. So I really appreciate you coming on. Do you have any last comments?
I have seen some improvement. I've been to ERs, out on the West Coast and the East Coast, and I have to say that most places that are big have security presence right up front, and that to get into an ER, you need an ID. You present your ID with your picture and your name on it. They check you in and out. It's much more controlled setting than it used to be, which is very good, I think.
Well, I'm really happy to hear that, Ginger, because what I'm hearing, and it happened at the hospitals that we may all know, their security guards are hands off. And it's happening elsewhere. So it's something to really look into.
Yeah, that's really too bad because it makes a difference. It makes a difference to the people, too. Patients and their families, I think, feel safer.
Yes, they do. When they see a security guard either dressed in a uniform or a suit jacket and pants. And we've seen both that were really great.
Yeah.
But again, we need to. Any other questions or any other comments?
Just that I'm really disheartened when I hear ER nurses, and I've talked to a few that young nurses, and they say, "Oh, it's part of the job." Being knocked around and being hurt is not part of your job.
You've got that right.
It never has been, and I really, I always talk them up and say, no, it's not. We need to love ourselves a little bit more. And once you have family that depends on you, you really need to protect yourself. And that's hard for, I think, nurses who are genuinely caring people who put themselves out there, don't have that self-preservation gene for some reason. But as you get older, excuses. You will develop it. Yeah. And well, it was very nice for you to have me on. I appreciate it.
Well, I think it's been great. It's great to hear you. I know that you have had a bad cold, and I appreciate you coming on. It's really important for the public to understand what has been going on and what will continue unless something happens.
Yeah.
And unfortunately, not too much has been going on. So I thank you very much, Virginia Weymouth Ferreira. Correct?
Correct. Thank you, Sheila.
All righty. So this will be the end of our program, and Jeannie White will produce the show, and she will get it out on all sorts of programs. And it will go on to stop healthcare violence.
Oh, great.
Okay?
Yes, very, very great. I'd love to chat with you some more at a different time when both of us are not coughing.
I know. It's really bad. Okay.
Well, thank you, everyone. This is Jeannie White. You were just listening to Sheila Wilson and her guest, Virginia Ferreira, and they were talking about incidents that have happened in the ER. And you will hear this episode again with a blog. Again, thank you from Jeannie White, Social Connections on Passionate World Talk Radio. Thank you, everyone. Bye now.